Good afternoon, dear colleagues, and happy to be here with you today, even in the virtual format due to other commitments. The theme that I was assigned today is One Health for Allergy and Asthma. These are my disclosures. None of them are relevant to the talk that I'm going to give today. So let's start by setting the scene in our discussion today and understand what is the challenge of the Anthropocene. What is this Anthropocene? It's an artificial era which is created by the man, by human pressure. This is why it's called the Anthropocene. And it started around 1950 with a process that is called the Great Acceleration. The era that was preceding this was called the Holocene. It was a natural geological era where we could see a typical variability that was ensuring the diversity of life on Earth. So there was an envelope of natural variability that is currently being lost due to this great acceleration. But what is this acceleration? As I was mentioning, there was some challenges to the Earth, starting with the Industrial Revolution, with intensive agriculture. You can see that they started, like, for example, in the 1750s, but only after 1950, everything accelerated in terms of pollution, in terms of population growth, in terms of water use, land use, fertilizers, technology, unhealthy food, so on and so forth. And this great acceleration and this challenge of the Anthropocene leads to breach in what we call the planetary boundaries. These planetary boundaries are described as keeping the planet safe. If you see green color, that means that we are still in below the boundary safe. If you see the yellow color, we are in the zone of uncertainty and climate change is over here. And if you see red, we are at high risk, so below the zone of uncertainty. And there, for example, the introduction of novel entities is in the red zone. So is the loss of genetic diversity. So these are very, very important risk factors for what I'm going to tackle today. By novel entities, for example, I mean microplastics and nanoparticles and many other aggressors that are currently happening now. Of course, also pollution. So the biogeochemical flow is over the bridge as well, and we are also losing the green water. Now, everybody knows about the impact of climate change on health. Besides the respiratory system and immunity and allergy that I'm going to tackle today, there are significant impact on the cardiovascular system, on the mental health, but also on pathogen and disease transmission, and we have all been experienced that have all been impacted by the pandemic that was really, really very bad for all of us. Now, why it is important to understand very well the mechanism and the impact of these environmental stressors. I will use for this the example of the heat stress, because everybody perceives the impact of these stressors like either on one system or organ or being very acute. So what happens during heat stress? First of all, it has systemic consequences. So it acts on the gut, on the heart, on the brain, on the lung, on the skin, and many more, and it also creates systemic inflammation. But what happens if we take, for example, a heat stroke lung? So just a location of where the heat stroke can create damage. You can see an increase in panels A to D, an increase in inflammatory cells, as it is to be expected. But you can also see a decrease, for example, in CD8 T cells, in NK cells, which means that we are more vulnerable to infections. This is something that is less anticipated as a consequence of a heat stroke. And also a significant decrease in the T regulatory cells, which means that the immune tolerance will be breached. Now, of course, there are histopathological changes that you can appreciate to the right. That means that the lung needs to regenerate. It regenerates because the lung is a good tissue in doing that, but it regenerates with overexpression of 3 types of genes. The genes are responsible for response to stress, for the immune system activation, and for the inflammatory response. What does that mean? That means that when you encounter another stressor in your life, after you have been exposed to heat stroke, you will overreact. You will overreact with an immune inflammatory process that will damage your lung instead of protecting you from that environmental stress. Now imagine that this is the lung of a child, and these are long-term consequences of one-time exposure to heat stroke in his childhood. Well, we are mentioning all the time the impact on the immune system. This comes directly as a consequence of climate change acting on what we call the human exposome. I will come back to that. Also, the wider environmental health determinants are important, like, for example, poverty or discrimination, and this leads to what we call the vulnerable populations, for example, the children, the elderly, the pregnant woman, the patients with chronic diseases, like we have our allergic diseases populations, and those with disability. Now, there is a partnership between all these environmental stressors and susceptibility factors, especially the epithelial barrier and the microbiome being not what they should be. Now, in the center, you have the generation of this immune dysregulation, and this is very important why our specialty should deal with these One Health approaches. And there is a steep increase in immune-mediated diseases, besides allergic diseases, also autoimmune diseases, cancer, but also metabolic disorders can be included into these epidemics. Now we know that I was giving the example of the epithelial barrier, which is concomitantly hit by different stressors. So, for example, the heat stress in the skin, the dust and air pollutions in the lung, food allergens in the gastrointestinal tract, and this creates a disbalance between tolerance and immune response, with the generation of inflammation of the allergic immune response, and it creates also systemic inflammation and tissue remodeling. I will introduce you now a very important concept, which is the concept of resilience. Resilience means what an individual human can do in response to environmental aggressors. And if the resilience response is correct, then you are, let's say, somehow protected by the environmental damage. I'm insisting on that because before we go into the One Health concept and what we can generally do as a society, I'm getting constantly being asked what we can do as individuals to protect ourselves against the aggression. So for this resilience, there are 3 key pillars. One is the integrity of the epithelial barriers. Epithelial barrier, skin, lung, and the respiratory tract, so also the upper airways and the gastrointestinal tract. Because if the epithelial barriers are breached, then aggressors like allergen, viruses, pollutants, microbes enter and encounter the immune system, and they start to create inflammation. The inflammation further breaches the epithelial barrier, and you can create a vicious circle there. Also, the microbiome becomes more diseased and expelled, and the natural dialogue between the healthy microbiome and the tolerant immune system is breached. Microbiome so becomes the second important pillar, and it needs to be kept in a tolerant mood. We are doing a lot of aggression directly on the microbiome through antibiotics, through diet, through other lifestyle changes that we are currently having, for example, excessive hygiene. Epithelial barrier we damage a lot through, for example, in the use of detergents, emulsifiers in the gut, pollutants, so on and so forth. The third key pillar is the diet, because the diet can either help you preserving your healthy barriers and also your healthy microbiome. So they all act together. And they all act together in establishing, maintaining, and regulating an appropriate immune response. We still need to understand a lot about the key mechanisms and especially on the key interventions on these three pillars, but at least have them in mind that some three important targets that you need to reinforce in an individual which is heavily exposed to environmental aggression. To understand this, we have to look at the complexity of the process, because as I was mentioning, it's not only the human body, it's the addition of your microbiome. This is what we call the holobiont. And the exposure is very complex, and it occurs during your lifetime. So before you are born, so since the conception until you die. And the complexity of the exposure we call a meta-exposome. And in this meta-exposome, you have many aggressors, as I was mentioning, like climate change, the usual culprits, climate change, indoor-outdoor pollutions, but also some aggressors that you don't immediately think of, like, for example, social stress or poverty. But you also have protectors that you can identify, like, for example, biodiversity, green spaces, good epithelial barriers, good diet, sunlight, balanced work, and I will come back to this, One Health education, which is also very important. Let's slowly approach this concept of One Health. Why is this important and relevant for us? Because allergy is a typical One Health issue, because we all identify environmental stress, pollution, climate change, global warming with pollen, for example, lifestyle changes, hygiene status, food processing with the breach of the epithelial barrier through emulsifiers, lots of biodiversity, loss of contact with green soil and nature as important determinants of allergic disease. Now, there are three concepts that are currently being used. What we use as a scientific community is the concept of One Health, because it is defined as a scientific multidisciplinary approach. Multidisciplinary because it includes human veterinary science, public health specialists, social science, and environmental health. A little bit broader is the concept of eco-health. Eco-health mainly focuses on resources and equity, and the main product of this eco-health is ecosystem management. It also includes, for example, anthropology in its domain. The most wide concept is the planetary health. And the planetary health is mainly used by policymakers because it focuses on social and political aspects and on natural resources and economic coupled with economic resources. So this also has social economic models which are central to the decisions that are being advocated. Now, One Health, as I was mentioning, is the one that we are involved into, because it's a scientific approach. It couples multidisciplinary human health, animal health, and environmental health. And it's mainly relying on this methodology, which is called the exposomic. The exposomic is an integrated approach to the environmental exposure. And you have seen that the meta-exposome has thousands of determinants. It's important to use this method because it provides you with a risk profile instead of single causality between one risk factor and the disease. And this is very important because it can prove causality instead of simple association. Now, we use this exposomic, and I will show you what we need to do for this methodological approach, because we want to build multifaceted interventions. So, do at the same time many things, like, for example, reducing the environmental stressors, but also restoring the microbiota, supporting biodiversity, improve immune tolerance, improve epithelial barriers, and advocate for healthy diets. This requires, resources, and of course, for that we need policy intervention. In the format of public health strategies, balanced use of resources, and very, very important, prioritizing solutions for the vulnerable populations, exactly the ones that are more amenable to change as well. If you want to observe the change, you also choose the vulnerable population. We, as healthcare professionals, are also an important part of this link. Together with our patients, we should create a joint front. We should continue counseling on resilience and avoidance, and we have to implement the environmental health precepts in daily routine. So when you see a patient in the clinic, you should inquire about his exposures and try to find an individualized solution to reduce his damaging exposure. And of course, who is best equipped to do the advocacy to policymakers to implement One Health concepts than the ones who are using it? The center of the One Health approach is this methodology, which is called exposomic. Exposomic means collecting lots of data from the external exposures, which we call the external exposome. And you can see that besides classical pollutants, we also look at social factors, ecosystems, lifestyle, smoking and alcohol, so on and so forth. To this, you add the data from the internal exposome, so how your body reacts, like in terms of inflammation, in modification of the microbiome, oxidative stress, and the epigenetic changes, as I was showing to you, for example, for the heat stress log. And to this, you add the outcomes, what you measure, the health impact, which can be disease, disability, aging, so on. Now, you collect, of course, big data, lots of data that you collect from here. So for that, you need the big data analytics, which requires AI modeling. And with that, you do several things. You can do individual level prediction, which is very important. So you build a risk profile. You do novel cluster discovery, so you can find new pathways. But most important, you explain the link between exposure and the disease. So this is the explainability and the causal analysis, because you want to go into precision personalized medicine and of course preventative medicine, which is tailored to different groups of individuals that you are targeting. These machine learning prediction models already work, for example, for air pollution in monitoring and prevention and in early warnings, for pollen in identification of pollen strains and for daily pollen counts. Then for system preparedness and early warnings for thunderstorm or for wildfires. And many more are currently being used. Problem is that we are living in a global world with a lot of connectivity, and if you look at the climate change regulations around the world, the more greenish or bluish you are in a good place. That means that in Europe we are doing well. You know that in the European Union there are huge efforts on the Go Green policies. The Balkans are not doing so well, we can do better. But again, if you look at the map, we are overridden by huge regions which are doing nothing. So this has to change at the global level, and let's hope that the new G20 and the new COP meetings will bring us more political resolutions in order to be able to create change. Until I don't want to leave you with a gloomy perspective, but to discuss with you what is currently being done. For example, in monitoring and research, we are currently using this data science approach. We are very much relying on biomarkers as indicators of disease, but most important, we are trying to build currently economic models in order to prove that the One Health interventions are worthwhile for the policymakers to invest into. Now, of course, reducing emissions to improve air quality is also something that we can also do in our labs, in our hospitals. Providing safe housing, again, advice for our patients is also important. Also, we can do more on increasing biodiversity and in improving diets. In the One Health approach, of course, we can look at improving agricultural practices, more impact on biodiversity, and of course, several other interventions that are amenable to society. With that, I would like to help you and looking forward to a good discussion with you. Feel free to reach to me through my email. If you have ideas for new projects or networks that we can set together, including in the Balkans, to tackle the climate change and environmental stressors using this One Health approach. Thank you for your attention, and thank you for the invitation to this meeting.